The Drive for Men's Health is a national men's health campaign. We drive across the country from here. We start in Orlando and we drive out to the West Coast. This is actually our fourth year doing it.
Awesome.
And and we engage as many men as we humanly possibly can throughout the journey. A lot of our live web chats are on the road from the middle of nowhere, so it kind of it makes it a little bit of a logistical issue sometimes. But we should be ready to go. So thank you, Dr. Walsh, for joining us on the Drive for Men's Health. You are officially one of our drivers because you, on a daily basis in your office, are constantly engaging as many men as you can to improve their health. And we do that as well as urologists in our office. But as we know, we can only interact with maybe 40, 50 patients a day in the office. But we got to get on the road and try to get as many people as we can excited about their health. So you are in Palm Springs? You mind telling us a little bit about your practice?
Yeah, Rancho Mirage, California,
okay.
Which is in the middle of Palm Springs is on the west end, and Rancho Mirage is about 10 miles east.
Ooh,
it's part of the Coachella Valley.
That sounds pretty exciting. How long have you?
10 years.
10 years, wow. And where did you train?
At UT Southwestern in Dallas.
Nice. That's beautiful. So you've been doing this for about 10 years now. You know, in the last 10 years, the life expectancy gap of men has still remained at 5 years. So what is your usual demographic over there in Palm Springs? Did you say most overweight and unhealthy and have various lifestyles? Just California, I know, is a little different.
People here tend to be much more active,
okay.
And they have a very active retirement communities, lots of golf courses, lots of outdoor activities, and so it's not uncommon to see a 90-year-old shoot his age on the golf course.
Really? That's good.
Yeah, it's pretty amazing.
So one of the most common problems that we see in our office is enlarged prostate. What's interesting is I've only been done with my training for 4 years, and I've noticed when I was in my training, maybe it was just a demographic, I used to see a lot more older patients, but now I'm seeing a lot more younger patients with enlarged prostate issues. Is that something you're seeing over there as well?
Yeah, I think that prostate BPH or enlargement of the prostate, it occurs roughly increasing at the age of 50. And then more and more people, over the years get it, such that like 80% of men over the age of 70 have it. And the concern is that only about half the men with symptomatic problems actually seek care.
Okay.
And a lot of the men that have BPH have symptoms that are either bothersome because they have frequency or urgency, or they have a weak urine stream, hesitancy, that kind of thing.
So why do you think only half the people come in to get it checked when they know they have a problem?
I think that maybe they're not aware of the treatment options, and that they think that, hey, this is just a normal part of aging. And with knowledge that, hey, making people aware that this is a condition, that there are treatment options, that they'll be more apt to seek treatment.
Yeah. So what could have some of these guys done beforehand to avoid even getting symptoms of enlarged prostate? Is there anything out there?
There's really not much that they can do to prevent it from happening. I mean, there's a large genetic component, and the increase in the size of the prostate is due to testosterone, and men need testosterone for maximum health, and so. But the idea is just being aware of the symptoms of BPH, which are obstructive and irritative symptoms. And if you are at a movie theater, let's say, and you can't sit through the show without having to get up 2 or 3 times, and when you go to the bathroom and you see a young kid next to you, and actually 2 or 3 kids come in and out of the bathroom while you're still trying to urinate, you may have a problem. And the saying is that bladder is a poor witness. That is, what you think may be going on with your bladder, people think that they're emptying fine. And this is the classic case where, you get a patient come into your office and he looks like he's 9 months pregnant, and you check his bladder and he's got 2 liters of urine in it. And then you talk to him and you say, hey, are you having any urinary problems? No, I'm urinating okay. And end up putting a catheter in, draining 2 liters of urine.
Yeah,
so that's not uncommon.
Yeah, they come in with these big bellies and think they've just been eating too much good cooking at home, and then you realize it's all a bladder full of urine. I mean, it's amazing, right?
Exactly. So the idea here is that we think that there's a window of opportunity that we can treat the prostate before there are irreversible bladder changes, because that unfortunate man, once the bladder gets stretched out, it doesn't work anymore. Mm-hmm. And I'm sure you've seen these ads on TV, 1-800-MEDICAL, get your catheters. Yeah. Millions of men have end-stage bladders. They don't work. So the idea is if we can treat them earlier, mm-hmm. During a window of opportunity, maybe we can prevent that from happening. Yeah. And certainly people that are on Flomax, which is a common treatment, an alpha blocker, even if they're on the medicine, they can go on to progress to not being able to urinate. Yeah. So medication alone, I don't think is the answer.
Yeah, so Flomax, for the audience, is a medication that helps relax the prostate, and then there's another medication that shrinks the prostate over 6 to 9 months. And so both medications sometimes can be used in combination. But, when you got a 50-year-old...
Right. That medication is...
Go ahead, sir.
Oh, yeah, you kind of broke up there for a little bit.
Oh, yeah. I can hear you, though. It's going to be a little delay because we have a major rainstorm.
Oh, good.
I'm showing our live viewers the rainstorm right now, but I can hear you. Go ahead.
Finasteride is another medicine that people can take to help shrink their prostate. It's indicated for men with symptomatic BPH, mm-hmm. with prostate glands that are greater than 40 grams, so larger than average. Yeah. And it's about 6 months, but they can note a 30% reduction in their prostate size. Yeah. Which is good. The other thing that the ProScar can do is that it can actually reduce the risk of needing a catheter and reduce the risk of... So the other benefit of it is that, it can improve your urinary function and prevent those other problems from occurring. The downside to it is it can have sexual side effects like decreasing libido that can be persistent even after the medication has been stopped.
Oh, really?
So, for people that are interested in preserving their sexual function, then I'm more reluctant about giving ProScar for that reason.
Okay. So, and then again, if you start these at the age of 50, that's 50 years staying on these medications. So it's do you take 1 or 2 pills for the rest of your life, or there are surgical options that we as urologists can offer? So do you mind kind of telling us what some of those are?
Yeah. So traditional treatment has been a transurethral resection of the prostate, or a similar one, a green light laser of the prostate, or a holmium laser enucleation of the prostate. Okay, all of those are surgical treatment options. Okay, fortunately, the newer option is called the Urolift, and I say new. It's actually been out, FDA approved since 2013, and the 5-year data has recently been published. That kind of fills the void between medicines and surgery, and this is why surgery can cause erectile dysfunction about 2% of people. It will cause retrograde ejaculation in the majority of people. That is, when they have sex, there's no ejaculate; it just goes back into the bladder. And then the final issue with it is it can cause a urethral stricture, which is scar tissue in the urethra that can obstruct. In general, it's the best, most effective option because you get about a 14-point improvement in the symptom score when you look at the IPSS score that we have patients fill out. That compares to about a 3-point improvement, so it's really mild with medication. A Urolift offers about 11-point improvement, so not as good as a TURP. Side effects. So there's been no new diagnosed cases of erectile dysfunction or retrograde ejaculation after the Urolift.
That's awesome. I think, and they just announced the 5-year data at our big conference this year, and that's what they found is and the thing is, the stuff is durable, so it's not like you get it done and then you need something done fairly quickly. Now, based on your experience, I know you've been a fan of Urolift, as we are, for since it became FDA approved, and probably even before that, because we've been following this technology for a long time now. What has been your personal experience with it?
Yeah, so I've done over 350 cases and a local anesthetic.
Oh, so you can do it in the office? Wow, that's because we still do it under sedation. So that's interesting. Okay.
Yeah, I mean, and what's really fascinating about it is that patients tolerate it really well, and it's got a good safety profile.
Mm-hmm. So do you mind telling us what, if they came to your office, obviously if they were a candidate, how does the procedure work? Like, what would they be doing from the second they get to the office till the time they go home? Do they have to stay in the hospital or not?
No, so I mean, in the office, when we do it in the office, they come in, we do a urethral lidocaine jelly, and we put in chilled lidocaine liquid that's balanced with bicarb, and then we do a prostate block, like we do for a prostate biopsy, just a transrectal ultrasound guided prostate nerve block. And then they wait about 20 minutes, and then we do the procedure. Procedure is done in our cystoscopy room, which you'd have that in the office,
Yeah.
and then afterwards we watch them in one of our waiting rooms to make sure that they can urinate, and we always have a nurse with them, making sure that we record their vitals. And there's always during their entire stay, and then we have a family member pick them up and take them home.
So you don't always leave
but they do really well.
leave a catheter in at all? Do you leave a catheter in or no?
If they fail their voiding trial, then we'll put a catheter in. Fortunately, about 70% of people pass their voiding trial.
Mm-hmm.
So fortunately, that's not an issue.
That's good. So do you have any interesting patient stories about the Urolift? You've done 350. It must be some.
Yeah, I mean, what a great story that I had is I had a patient that came in. He was markedly symptomatic, and he had a golf tournament coming up 2 weekends away.
Okay.
And he had a lot of frequency and urgency and a slow urine stream, and he'd just come down from Canada, and so I talked to him about a TURP. He didn't want to do that because he wanted to be back, and so he was a candidate for the Urolift. We worked him up, and then we did the procedure in the office. Within a week, he was back on the golf course practicing, and then he did his tournament, and I think he did first in his flight. So he was really ecstatic about the whole situation.
Oh, that's awesome, man. That's awesome. I mean, we have similar stories. I mean, I've had 2 guys that are in their 50s, really small prostate glands when you measure them, but they were very symptomatic when we saw them. We got it covered. Actually, when we first started doing them, insurance coverage was difficult, but now we haven't had any really major issue with getting it covered through insurance, and I'm sure it's the same for you as well.
Yeah, absolutely. In our community, Medicare covers it, Kaiser covers it. Or Blue Cross and Blue Shield.
Yeah. So as we were talking about earlier, our whole initiative is driving across the country and encouraging men to take better care of themselves. And our big theme this year is that young men need to start communicating much more effectively at home and talking to their children or their parents, family members about their health and especially sexual health. So that's why Urolift is so important this year for us. Is we do things when we're younger. We may eat bad, we may not exercise, and that may lead us to have sexual issues down the road. But sometimes even we can cause those problems with some of the things that we do as surgeons. So I think that's why Urolift really helps us as physicians provide the best treatment outcomes for our patients. Hey, bud, can you hear me? Lance?
I can hear you now.
Oh, sorry, man.
Can you hear me?
Yeah, I can hear you. We went through a little bad patch here on the road, man. I'm sorry, man. It's one of those things where when you're
Hey, no problem.
But as I was saying our big focus this year is getting men talking about their family histories and their sexual health at a younger age. So a lot of the young men that we talk to never even know they have to go see a doctor. So if you had like 5 basic tips for men out there based on your experience, doesn't have to be anything urologic, but 5 things that they can do, or 3 to 5 things they can do at a young age to avoid having to see you or me down the road.
Can you repeat that one more time?
Oh, I was saying
the last part of the question.
Yeah, so are there 3 to 5 things that you can tell young men out there that they can start doing today to avoid having to see people like you or me down the road?
So, in terms of prevention, there's not much dietary or exercise that they can do. And I think, if they look at their father and their grandfather and they had prostate problems, that may be a good indication in what's in store for you in the future.
Yeah.
And so, 2 things, one, be aware of your genetics, but the second thing is also be aware of, what your urinary habits are. If you're going to the bathroom more frequently than your friends, if you go to the stall and you're there a much longer time, you may have a problem.
Yeah.
And that's when it's important that you'd want to seek care. And young guys can have problems too, so don't be afraid of seeing your urologist.
Yeah. Absolutely. Well, Dr. Walsh, thank you so much for joining us today on the road, and thank you for driving with us, even through the hiccups of the road and the little bumps. And we actually are going to be in LA on Thursday night doing a Soul Cycle class.
Oh, fantastic!
Yes, if you want to come on down to Soul Cycle, we would love to see you there. But I know it's a little far from where you are, correct?
Well, yeah, it is, and maybe you can, on your way back, you can jaunt through Palm Springs. Are you taking the I-10 to get to LA?
Yeah, yep. Well, we go to LA, and then we drive to Salt Lake City to do a 5K with 0 prostate cancer.
Hey, fantastic! We're right off the 10.
Oh, really?
Literally about 5 minutes off the 10. If you want to drop by, give me a call.
Yeah, maybe we will. Are you in the office on Friday?
Absolutely.
Okay, so let's touch base on this, but let's touch base online and see if we can make it happen. But otherwise, thank you so much.
All right, that sounds great.
Yeah. All right, bud. We'll see you, man.
All right, bye.
I think he had to go back to clinic. Dude, I was.
You can take a plane there. You should really